So currently for patients with CML, chronic myeloid leukemia, treatment-free remission, discontinuing TKI is a well-established therapeutic goal. But same is not true for Ph-positive ALL in CR1 who do not go to stem cell transplant, and the duration, how long do we need to continue TKI, is unclear. So in this analysis, we did a retrospective chart review of patients at MD Anderson, and we identified 14 patients who were Ph-positive ALL, who were in complete molecular remission in CR1, and then they stopped a TKI, most likely for toxicities. And we then looked at their outcomes. And 3 of the 14 patients subsequently had a molecular relapse. But what we've also noted is that all the 3 patients had less than 4-year duration of CMR. There were 6 patients who had a more than 4-year duration of CMR, and none of them had a relapse so far. So I think this makes an argument and hypothesis that potentially you could consider stopping a TKI, again with a small number of patients in a retrospective analysis, maybe at least 4 or 5 years of complete molecular remission. And I would also highly recommend that if you were to do that in practice, you should also assess for the MRD, preferably by next generation sequencing assay, to make sure there is no absence of any malignant B cells in the patient before you were to attempt stopping a TKI. So I think this is a new kind of a relatively new concept, and I think we need to know more data, but this provides an initial data set where I think clinicians can look and think about potentially stopping TKI if you meet a strict criteria which we have outlined in the abstract.